The FDA just sent a formal warning letter to the maker of Ozempic and Wegovy, and if you're taking semaglutide or thinking about it, you need to hear what's actually in that letter before your next dose. Hey, welcome back to Bariatric and GLP-1 Support by Will Talk Nutrition. I'm your host, Tradina, and today we need to talk about something that dropped in the news recently that has a lot of people in our community understandably worried. The FDA sent a formal warning letter to Novo Nordisk, the company that makes Ozempic and Wegovy. And before the headlines run away with this, I want to give you all the full clinical picture so you know what this actually means for you. So, here's what happened. The FDA alleged that Novo Nordisk failed to properly report and follow up on 3 deaths of people who were taking semaglutide, the active ingredient in both Ozempic and Wegovy. Now, let me be very clear. A warning letter from the FDA does not mean the drug is being pulled. It means the agency identified a compliance issue in how the company reported safety information. These are 2 very different things. But, and this is a big but, it raises a really important question that I think every person taking one of these medications deserves to ask. Am I getting the full picture about the risk? Here's what we know from the clinical research on semaglutide. The most common side effects are gastrointestinal, nausea, vomiting, diarrhea, constipation. Those are well documented, but there are rarer, more serious risks that deserve your attention, such as pancreatitis, gallbladder disease, a rare thyroid cancer risk in animal studies, and for some people, serious mental health challenges. As a dietitian who works with people navigating both GLP-1 medications and bariatric surgery, here is my honest take. These medications have genuinely helped a lot of people. The research supporting their use for obesity and type 2 diabetes is strong, but pharmaceutical companies have an obligation to be transparent, and when that transparency is questioned by the FDA itself, we all have the right to ask more questions of our own doctors. So, what should you actually do with this information? Number 1, do not stop your medication without talking to your prescriber first, because abrupt discontinuation can have real consequences. Number 2, at your next appointment, ask your doctor specifically about updated safety reporting on semaglutide. You have the right to that conversation. Number 3, track how you feel. Keep a simple log of any new symptoms and bring it to your provider. Number 4, and this one really matters, make sure that you do your research on any compounded versions of semaglutide that you see online, because they need to be regulated. The pharmacy that produces them at least needs to be 503A approved. And these aren't really regulated by the FDA. However, we all know that the FDA has their own little incentive sometimes. So just keep that in mind. Do your research. Make sure that the pharmacy has licensed pharmacists in good standing and that the pharmacy is 503A approved. To ensure that you are receiving a compounded GLP-1 medication from a legitimate 503A or 503B pharmacy, check the labeling for the pharmacy's name and address, then verify their status with the FDA for 503B or 503B or State Board Pharmacy for 503A. A reputable provider will display their licensure, use USP or United States Pharmacopoeia grade ingredients, and provide a certificate of analysis. The key differences in verification methods include 503A pharmacies, which are the traditional pharmacies, require prescription from your doctor for a specific individual. They are regulated by state boards of pharmacy and focus on custom, small batch, patient-specific medications. 503B pharmacies, which are outsourcing facilities, are registered with the FDA, adhere to stricter current good manufacturing practices, and can sell in bulk. You can verify them on the FDA's list of 503A outsourcing facilities. How to verify? Look at the product label for the facility name, then check the FDA's registered outsourcing facilities database. If it's a 503A, search the pharmacy's name on the state's board of pharmacy website. Now, here's a red flag. If a telehealth company refuses to name the pharmacy, or if the drug is exceptionally low in cost, like let's say it's $100 for 3 months, that's crazy. That's just not going to happen. No reputable company is going to do that. So it may not be coming from a reputable licensed facility. Now, as of late 2024, FDA regulations limit the compounding for drugs like tirzepatide when they are not in shortage. So just be aware of that. Look, I know the news cycle around these medications can feel very overwhelming. My job here is to cut through the noise and give you information you can actually use, not scare you, not to dismiss your concerns either. You deserve both honesty and support. But before I go, if you want ongoing support from a community that actually gets it, come join my free Facebook group, Bariatric and GLP-1 Support by Real Talk Nutrition. The link is in the description. We talk about all of this. And if you're ready to go deeper, I have a monthly group coaching membership called the Real Talk Continuum. It's where we do the real work together. Nutrition, mindset, the whole picture. Details are in the description below. If this video was helpful, please subscribe and hit the notification bell so you never miss a new episode. I post new content regularly and I don't want you to miss it. I'll see you next time.